We will go over the axial skeleton. Axial skeleton, you already know, consists of the skull, thoracic case, and the vertebral column. So this part is the axial skeleton. So we'll talk about the bones of this part of the skeleton. Okay. So first we'll talk about the bones of the skull. This is the skull, and in the skull you have two sets of bones. Cranial bones that form the cranial cavity in which the brain is located. Okay, so these are the cranial bones, and facial bones give the framework of the face. So these are two groups of skull bones. First we will talk about the cranial bones, then we will talk about the important or large facial bones. Then we will talk about the bones of the thoracic case. And then we will talk about the vertebral column. Okay, so those are the bones of the axial part of the skeleton. In the axial part of the skeleton, you have total 80 bones. And here in this picture, you see two parts of the skeleton have been shown by two different colors. So that cyan bluish color, that's the axial skeleton. So skull, thoracic case, and the vertebral column. Okay. Cranial bones. Cranial bones, as I have already mentioned, form the cavity, and the brain is located inside that cranial cavity. So around the brain you have the cranial bones. Cranial bones also provide sites of attachment for head and neck muscles. How you see here, these are the cranial bones, right? So these are the cranial bones, and from the neck some muscles go and get attached to the lower part of the cranial bones like this, right? And also some head muscles like temporalis, occipitalis, frontalis, those are located here. So some go from bottom, those are the neck muscles, and get attached, and some are already attached over the cranial bones. So those are the muscles. Now facial bones, as I have mentioned, form the framework of the face, and facial bones form some cavities, important cavities in which important sensory organs are located. You already know the orbital fossa for the eyeballs, right? Important sensory organs. Nasal cavity for the nose. Oral cavity for the tongue and other structures. So those important sensory organs are housed in those cavities formed by the facial bones. Okay. Opening for air and food passages. Also, the oral cavity, nasal cavity, those are formed by the facial bones. Site of attachment for teeth and muscles of facial expression. Many small muscles are attached to the facial bones, and some of those muscles help in your facial expression. When you get angry, right, your face changes. When you are happy, your face, by looking at your face, someone can tell, right? When you are sad. So those are the facial expressions given by some facial muscles. Those are the small muscles attached to the facial bones. Another very important function of some facial and cranial muscles is mastication. movement of the mandible. You know, we move the mandible when we speak, when we chew the food, right? Those are also very important functions, not listed here, I believe. But cranial and facial muscles together help to move the mandible. That helps in our speech and mastication, chewing the food. Here you see two sets of bones, cranial bones and facial bones. You are looking the side view. So there are 8 cranial bones in the skull. What are those? We have one frontal bone here in forehead area. So one frontal. Then behind that we have 2 parietals. So this is one, this is another. 2 parietal bones. And below the parietal we have temporal. So we have 2 temporals below the parietal. Temporals are just around the ear. So temporal, and above that parietal. And in the back you have occipital bone, this one. So frontal is in the front, occipital in the back, and parietal, upper lateral, and temporal, lower lateral. So you got how many? 1, 2, 3, 4, 5, 6. What are 2 others? 2 others are mainly forming the floor of the skull under. What are those? One is sphenoid, another is ethmoid. So ethmoid and sphenoid, those are mainly forming the floor of the skull. So those are the 8 cranial bones. So only 2 are paired, parietal and temporal, others are single. Here, the frontal bone, you can see the almost the whole part of the frontal bone, because this is in the front of the skull. Then behind the frontal you see red colored, those 2 are parietal, and below the parietal you have the temporal. Those bones you can see here, and occipital you don't see because occipital is in the back, right? So you don't see that. Now if you look through the orbital fossa, you can see a small part of ethmoid and sphenoid. So small part of ethmoid and sphenoid you can see, but most part is in the floor of the skull. So those are the cranial bones. Now the facial bones. Large facial bones are maxillary bone. There are 2 maxillary bones. They join together to form the maxilla. So you see here, sometimes if you don't know, you may think only one bone is here. This is the maxilla, upper jaw. Upper jaw bone is the maxilla, but developmentally, maxilla is actually formed by 2 bones. 2 maxillary bones fuse here to form the maxilla, okay, or upper jaw. Then you have the lower jaw bone, that is the mandible. Mandible is the only bone that moves, okay. So this is the only bone in your skull that moves. Other bones are fixed. Then you have zygomatic bones, also known as cheek bones, here, from the prominence of cheek here. So mandible, maxillary bones, zygomatic or cheek bones. Then you have nasal bones here. 2 nasal bones, those are tiny bones, join to form the bridge of the nose. So the bridge of nose is formed by the nasal bone. Then you have nasal concha. Some people say concave or concha. There are small bones inside the nose. Those are called nasal concha. Then you have vomer inside the nose. There is another bone. You see that is in the lower part of the nose. That is the vomer. So those are some facial bones you can see in this picture. Lacrimal bones. Behind the nasal bones, you have lacrimal bones. Okay? Lacrimal bones have fossa called the lacrimal fossa, in which the lacrimal gland, the sac of lacrimal gland sits, from where the tear, the water comes out from the lacrimal sac. So those are the facial bones you can see here. Now sutures. Sutures are the joints in the skull, and the cranial bones join to each other at the sutures. So what are the sutures present in the skull? Important sutures or large sutures are coronal suture, sagittal suture, lambdoid suture, and squamous suture. So those are, there are a couple more, but these are the main ones. Coronal suture is this one. You see here this way. So this is the coronal suture. You must remember this plane is called coronal or frontal plane, right? You have learned that in the lab part. So same name, this way, since it is going this way, that's the coronal suture. Coronal suture connects the frontal and parietal. So this is frontal and this is parietal. They are connected by coronal suture. Then this is the squamous suture. It connects the parietal and temporal. So parietal above, temporal below. So this is the squamous. So you have two. This one is called the lambdoid suture. You see here, going like this. So this suture connects the parietal and occipital. Parietal in the front, occipital in the back. So coronal, squamous, lambdoid. Then another large suture, that's the sagittal suture, this one, midline of the skull. And this one connecting two parietal bones together. So two parietal bones are attached at the sagittal suture. And you also know, learn from the lab part, this is the sagittal plane, right? Remember that? Coronal plane, sagittal plane. So this is sagittal suture, this is coronal suture. Make sense? So those are the sutures. You need to know the name of those sutures and which bones are attached by those sutures. Okay. Here in this picture, you see the side of the skull. So you can see some bones better here in this picture. So let's see. You see the coronal suture connects the frontal and parietal. You see the squamous suture, parietal above and temporal below. You see the lambdoid suture, parietal in the front and occipital in the back, right? As I mentioned, there are small sutures too. You see the occipito-mastoid suture. If you look in the left, 1, 2, 3, 4 from the bottom, occipito-mastoid here. This is the occipital bone, and this is the mastoid process of temporal bone. This structure. So that's why this suture is called occipito-mastoid suture. So those are the sutures in the skull. This is the bottom of the skull. If you look from the bottom, inferior view. Okay, inferior view. of the skull. Now you see one thing is remarkable here. What is that? There are many holes or openings in the floor of the skull or bottom of the skull. Why there are many openings or holes there or foramen there? The reason is, you know, that many blood vessels, right, enter into the brain and nerves come out, right, from the brain. So those are mostly for the nerves and the blood vessels. Arteries, veins go to the brain, right? So pass through those foramens or holes. The largest one you see here, that is called foramen magnum. Foramen magnum, magnum means big or large, and foramen is the opening, kind of round opening. So that's the largest one. Spinal cord descends from the brain through that foramen. So that's the largest one. You see carotid canal, jugular foramen. Those are for the blood vessels, you know, carotid artery, probably you have heard the name, carotid artery, jugular vein. So those are for the arteries and veins. Anyway, so you will see many foramens. Here you can see the sphenoid clearly. You see the red colored bone, which looks like a butterfly or flying bat. So flying bat or butterfly shaped bone, that is the sphenoid. Okay, so let's go to the individual cranial bones. We will talk about few cranial bones individually. So this is a temporal bone. Here, this is the temporal bone. Look in the skull. This is the temporal bone. Now, temporal bone has a flat upper portion, which is just a flat bone in the upper part, and a number of structures in the lower portion. So lower portion is complicated, upper portion is simple. Upper part is simple flat bone, and lower part has a number of structures. So which structures you have there? You see processes. There are three processes: zygomatic process, mastoid process, and styloid process. So processes are like this. Look at me. If this is a bone, if you see something sticking out from the bone, we tell those are the processes. Okay. So from this bone, what are the things sticking out? Let's see. One, you see this piece going to the zygomatic bone. This is the zygomatic bone, you know that. So that's why this part of temporal bone is called the zygomatic process. Make sense? Because it is going to the zygomatic bone. That's why it is called zygomatic process of the temporal bone. This one, you see, kind of blunt, round process. This is called the mastoid process. And this one, you see, very sharp, pointed. And this one is called the styloid process. So zygomatic, mastoid, styloid. So those are three processes in the temporal bone. There is a passage for the ear, you know that. That is called the external acoustic meatus. Meatus is canal, canal-like structure. So external means outer. So you can see this from outside, the outer ear canal opening. That's the external acoustic meatus. Okay. There is a fossa that is called the mandibular fossa. Why? You see, if you just think why the name is like that, it becomes very easy. Here you have a fossa. You see, I can put my finger. This is the fossa, depression, Why it is called mandibular fossa? Because this part of mandible goes in. This is the mandible, we know that. So this is the mandibular fossa. So those are some structures in the lower portion of the temporal bone. Now this mastoid process, this one you can actually feel just behind your ear lobule. If you press, you see kind of elevated part, that is the mastoid process, right? And you know, sometime if your doctor suspects or wants to test if you have ear infection, will press on that, okay? Because there are sinuses here inside, some pus can accumulate there. If you press there, you will feel pain.
Is it always going to come that long?
There are two ways. Sometimes you will see the doctor will pull the ear lobule, right? So external outer ear infection can be tested by mastoid, pressing the mastoid, but inner ear infection you need to pull this, okay? Anyway, so that's the temporal bone. This is the sphenoid bone. It looks like a butterfly or bat. So since it looks like a butterfly or bat, it has a body in the middle and wings at the sides. So how many wings it has? It has 4 wings, 2 pairs. 2 are greater wings, those are larger, and 2 are lesser wings, those are smaller, and a body. Now if you see the body part, the upper surface of the body, you see, if this is the body, upper surface of the body has a fossa, again fossa, depression. That is called the hypophyseal fossa. Why? Because pituitary gland, you know, the master gland, sits there in that fossa. And another name of pituitary is hypophysis. So hypophysis is another name of the pituitary gland. So that's why this fossa is called hypophyseal fossa, fossa for the pituitary gland. And now under the lesser wings you have optic canals. You will see 2 canals under the lesser wings, and optic canals are for the optic nerves, very important nerves, you know, from the eyeball, optic nerves take the signal to the brain, the visual signal, right? Optic nerves. So 2 optic nerves from 2 eyeballs pass through the optic canal, okay? In the back part of the greater wing, you will find foramen oval, oval shaped foramen. That's why called the foramen oval. And so this bone has a body and 2 pairs of wings and couple of one fossa, important fossa, hypophyseal, and just optic canal and foramen oval. If you just know those, should be fine. This is the ethmoid bone. Ethmoid bone is difficult to see because most part of ethmoid is inside the nose. So from outside you can only see a small part I showed you when you looked at the front view of the skull. Here only a small part you can see, but most part is inside here. Anyway, so ethmoid bone has a middle portion and 2 lateral muscles. So 2 lateral muscles has a middle part and 2 lateral muscles. In lateral muscles you have many air cells or sinuses. So these are the air cells in the lateral muscles. So you see there, those are called ethmoidal air cells or sinuses, contain air. Now the middle portion, in the top part of middle portion the structure is called crista galli. So the top part of middle portion here, that is called crista galli. You see the picture there. And then the lower part is like a flat plate of bone going downwards like this, straight like this, going flat plate of bone is going downwards, and that is called the perpendicular plate of ethmoid. Perpendicular plate of ethmoid. That part you can see inside the nose. This is the perpendicular plate of ethmoid, and what happens, this plate is going inside the nasal cavity and forming the upper part of nasal septum. You know that nasal cavity is divided into two halves, right? So the upper portion of that nasal septum, that hard part, is formed by the perpendicular plate of ethmoid that is going down straight. Okay. So again, ethmoid has a middle portion and two lateral masses. Lateral masses contain many hair cells. Those are the ethmoidal hair cells. Middle portion, the upper part is called crista galli, and lower part is the perpendicular plate of ethmoid. Okay. Now this is the floor of the skull or cranial cavity. Now you can see the sphenoid here, the location or position of sphenoid in the skull, forming the floor, right, of the part of the floor of the cranial cavity. You again see the two greater wings, two lesser wings, right? Optic canal, we have already talked about that. Hypophyseal fossa for the pituitary gland. You see foramen oval, right? So that's the sphenoid. Now, in front of the sphenoid, you can see the very top part of ethmoid. So now let's see. You remember the upper middle portion of ethmoid is the crista galli, this extended part. So you can see crista galli there. In the top left, you see the ethmoid bone, crista galli. And in both sides of crista galli, you have bony plates, and in those plates, those two plates, you have many tiny foramen. Many tiny foramen. These two plates in both sides of crista galli are called cribriform plate. So you see there, cribriform plate in the picture. So I am not writing. And in the cribriform plate, you have tiny foramina. Foramen is large, foramina is small. Okay, open. So many foramina. Those are called the olfactory foramina. You see from second from the right top. Olfactory foramina. Foramen is large opening and foramina is smaller. It's like, parent and child, right? So many tiny openings, those are called the olfactory foramina. Why olfactory? Because now you see this part is sitting just on the nose, above the nasal cavity. So from the nose, olfactory nerve fibers go to the brain through those olfactory foramina. Very simple. Who pass through the foramina? Olfactory nerve fibers. That's why those foramina are called olfactory foramina. Olfactory nerve fibers carry what kind of signal? You all know. Smell, right? Olfaction. Olfaction is the smell from the nose, goes to the brain through the nerves, nerve fibers. So sometime what can happen, if any accident happens, like something hits your nose from the front, what can happen, that olfactory nerve fibers can get damaged or crushed, because you know that this is the cribriform plate and nerve fibers are passing through the olfactory foramina, right? Now if that cribriform plate moves like this, moves like this, what will happen? The nerve fibers will be destroyed, right? Destroy the nerve fibers. And in that case, anosmia, lack of smell, the person will lose the ability to smell. That is called anosmia. Okay, the person will lose the ability to smell something. That can happen. Anyway, you see in the back you see the occipital bone and foramen magnum. Foramen magnum is in the occipital bone. Spinal cord gets out from the brain through that. Okay. Facial bones. I have already mentioned what are the facial bones. Mandible is the lower jaw. Maxillary bones form maxilla. Two maxillary bones together form the maxilla or upper jaw. Then two nasal bones, two lacrimal bones, two palatine bones that I didn't mention form the palate. You know, this is the hard palate. If you put your finger inside your mouth and move up, you will touch the hard part, the roof of the mouth. That's the palate, right? You probably know. So two palatine bones form the palate, and vomer I have mentioned inside the nose, the lower part is the vomer, and nasal concha or concave. So those are the facial bones. Now mandible is the lower jaw bone. This is the strongest bone of the skull, or we can say strongest bone of the face, and this is the only movable bone of the skull. So only this bone moves, and where it moves at temporomandibular joint. This is the temporal bone, this is the mandible. So this joint is the temporomandibular joint. You must remember in temporal bone, I showed you the fossa. I showed like this. I can put my finger there. That's the mandibular fossa in the temporal bone. So the mandible goes there. TMJ, probably you have heard, temporomandibular joint, TMJ. Why it is important, you know, sometimes locked jaw. Have you heard that term? That can occur in that joint. If you see a mandible, it has a body, which is this part, body of the mandible, and ramus, this arm shaped part. Like if you look at me, this is my arm, so this part is like this, if you see from the side. So this is the ramus, this is the body. So there are two ramus, this is one, this is another, right? Now body of mandible, ramus of mandible, you can see in this picture. Now first let's talk about the body part. The upper surface of the body, you have the lower teeth attached. So lower teeth are attached to the upper surface of the body of the mandible, and the area where the lower teeth are attached, that area is called the alveolar margin. Alveolar margin. And if you see the front of the body, you have, if you look carefully here, you have tiny opening. One in this side, another is in this side. So those are called the mental foramen. Why those are called mental foramen? Because you already know this area is called the mental area. You remember mental area, this area. So the name is mental foramen. And if you see inner surface of the ramus, inner side, that means this side, inner side of the ramus, you have another foramen. So you have two ramus, so two foramen. Those are called the mandibular foramen. So two pairs of foramen are present in the mandible, two mental foramen and two mandibular foramen. Now if you see the upper part of the ramus, there are two structures, and you see here the upper part of the ramus, two structures. This part I have already mentioned forms the temporomandibular joint, right? So this is the mandibular condyle, and this part is not attached, it is free, and this part is called the coronoid process. So let's see there. You see the mandibular condyle in the back and coronoid process in the front. So two coronoid processes, two mandibular condyles. And yeah, so this is a very useful bone because you always move this bone, right? When I'm talking, like I'm always moving the mandible, right? When you are chewing the food, always move the mandible. So very, very helpful bone. Maxillary bones, two maxillary bones join to form the maxilla, right? Upper jaw, and maxillary bone is known as keystone bone. Why it is called keystone bone? Because you see here, maxillary bones or maxilla is located in the center of the face, here, sitting in the center, and this bone articulates with all other facial bones. There are 14 facial bones, and maxilla is attached to all facial bones except the mandible. So mandible is the only bone which is not held by the maxilla, but all other facial bones are held together, held in the face by the maxilla. That's why it is called the keystone bone, sitting in the center and holding the facial bones except the mandible. This is one maxillary bone. You see the lower portion of this bone articulates with the teeth, upper teeth, and the border where the teeth are attached is called the alveolar margin. So same thing, you have alveolar margin in the mandible for the lower teeth, alveolar margin in the maxilla for the upper teeth. You have two processes here. You see the frontal process and zygomatic process. This is very easy because you see here, this is the maxilla, and a part of this bone is going to the frontal bone. You know, this is the frontal bone. So this part is going to the frontal bone. That is called the frontal process of what? Maxilla. And another part, you see this part is going to the zygomatic bone. That's why this part is called the zygomatic process of maxilla. So makes sense. And inside the maxillary bone, you have the largest sinus. Sinus is cavity inside the bone filled with air. So air filled cavity inside the bone is a sinus. And the largest sinus is the maxillary sinus located inside the maxilla. So basically, if you drill the bone inside, you will see, or cut the bone, you will see big cavity inside. Okay, and that is the sinus. And you know the term sinusitis. I'm sure all of you know that, right? Sinusitis. Sinusitis is the inflammation of the sinus. Itis is inflammation, right? Itis, conjunctivitis, laryngitis, pharyngitis, tonsillitis, hepatitis, nephritis, you know, hundreds, right? Why? we use itis. Itis is refers to inflammation of that particular structure. So that's simple. So sinusitis is the inflammation of those cavities, sinuses. So if you see inside the maxilla, like this is the maxillary bone, inside you have a big cavity, that's the sinus, maxillary sinus, and in the wall of the sinus you have mucous membrane, right? Soft mucous membrane is here and air is here inside. Now, if that mucous membrane gets infected by microorganism, then you will feel the symptoms. What are the symptoms? Pain, heaviness of the head, right? And other headache, other complications. When this mucous membrane gets infected, it secretes fluid. So this space gets filled with fluid and microorganisms can spread easily inside that, right? So what you can do if the condition is really bad, you can draw the fluid out and also give antibiotic and antihistamine, those kind of medicines to treat the inflammation. Okay, so that's sinusitis. Zygomatic bones. These two are zygomatic bones or cheek bones. Okay, and if you see here, zygomatic bone forms the lower lateral, that means inferior lateral margin of the orbital orbit. So this is the orbit and this is the zygomatic bone. So it forms the lower part as well as the lateral part. So lower lateral portion of the orbit. Nasal bones, lacrimal bones, I have already mentioned. Two nasal bones, those are tiny, form the bridge of the nose, and lacrimal bones are here, and you have lacrimal fossa for the lacrimal sacs. Sacs contain tear. Okay. So those are the bones in the face. Palatine bones. Palatine bones, from its name, you can tell what it does, right? Palatine bones form what? The palate, right? Hard palate. Since it is bone, it must form the hard part of the palate, right? So, palatine bones, two palatine bones joined together to form the part of the hard palate. Only posterior 1/3 of the hard palate is formed by palatine bones. Anterior 2/3, the anterior 2/3 part is formed by the maxilla, because you know this is the maxillary, these are the maxillary bones, right? So the front part, anterior 2/3, is formed by the maxillary bones, because we know these are the maxillary bones. So front part is formed by the maxillary bones. How much? 2/3. And posterior 1/3 part is formed by the palatine bones. Vomer is a ball-shaped bone inside the nasal cavity. Now, anybody remember? Let's check your memory. I told you ethmoid bone. I did draw here. Has middle portion, right? And the lower part of middle portion goes down like a straight plate, right? Flat plate of bone inside the nose, and that forms what? Goes inside the nasal cavity and forms. That's the name is perpendicular plate of ethmoid, and it forms the nasal septum. You remember partition that divides two halves, and that is coming from above and forms the upper part, upper bony part of nasal septum, and vomer is below. And you see they go like this. This is vomer and this is the perpendicular plate of ethmoid, and they join together to form the hard part or bony part of nasal septum. So vomer from below, perpendicular plate of ethmoid from above to form the bony nasal septum. So that's why you see here vomer forms the lower part of nasal septum. This is the nasal septum. Now you can see the yellow part is the perpendicular plate of ethmoid and the blue part is the vomer. Those two are the bones, right? So they join together to form the hard part or bony part of nasal septum. Now in the front you see you have cartilage, and that's why you can move. You see you can move the front part of the nose like this, right? Because the front part of nasal septum is cartilage, not bone. Back part is bone. So the front part is cartilage. It's a hyaline cartilage, and in the back you have the bony part formed by those two bones. Okay. So if I ask you, the palate, roof of the mouth, is formed by which two bones? Anterior 2/3 is formed by maxillary, right? Anterior 2/3, and posterior 1/3 by the palatine, because palatine name is palatine bone. Yeah, posterior 1/3, right? So that's the palate. Now, if I ask you nasal septum, bony part is formed by which two bones? From above, perpendicular plate of what? Ethmoid, right? And below, vomer, right? Those two bones form the hard or bony part of nasal septum. In the front you have what? Cartilage, right? That's the soft part of the nasal septum. So that is the nasal septum. Okay. Sinuses, I have already mentioned that air-filled spaces. Some sinuses are called paranasal sinuses. Those are around the nose. Paranasal sinuses. So the sinuses of the facial bones make the skull light because those are not solid bones. Inside those bones you have cavities, and because of air-filled cavities the bones are light, and all those bones make the skull lighter, decreases the weight, reduces the weight. Also, the sinuses around the nose, paranasal sinuses, like two big maxillary sinuses, frontal sinus, those are the sinuses, ethmoidal sinuses or air cells I have shown you. Those sinuses help to amplify the sound, intensify the sound, okay, enhance resonance of voice. And sinuses are present inside the frontal bone called frontal sinuses here. This is the frontal bone, you know already. The frontal sinuses are here. Sphenoid. Inside the sphenoid you have sinus. Those are called sphenoidal sinuses. Then ethmoid, I showed you in the lateral muscles you have many air cells, right? So those are the ethmoidal air cells or sinuses. And maxillary, largest sinus in the maxillary bone, maxillary sinuses. So frontal sinuses here, ethmoidal sinuses, ethmoid is inside, so inside the ethmoid, and sphenoidal sinuses and maxillary sinuses here, the large ones. Here you see the location of those sinuses, and red colored, those are the maxillary sinuses. Hyoid bone. This is an interesting bone in your body. You see here, this is the hyoid bone. Hyoid bone is also known as lonely bone. Okay, lonely bone. Why it is called lonely bone? Because no one wants to take him as his part. For example, when we talk about, you see, when we talk about the skull, we talk about cranial and facial bones. We don't include him, right? When we talk about the thoracic case, we don't include him. When we talk about the vertebral column, we don't include him. So nobody wants to include him. Okay, so he is the lonely bone, and this bone is not attached to, directly attached to any other bone physically. not attached. Then how this bone is staying here? By the ligaments. So not directly attached to any bone. Ligaments hold this bone there, the upper part of the neck. And this bone has a body and two pairs of horns, lesser horns and greater horns. Now, why this bone is important? You see, this bone is very important. Why? Because the front of the neck, you have a number of muscles here. These muscles get support by this bone because this is the only bone here. There is no other bone. So these muscles here, many of them are going to the tongue, going to the mandible, right? So these muscles are important muscles. Anterior neck muscles get support from the hyoid bone. And those muscles mostly help in what? Production of speech, swallowing of food, right? When you swallow the food, these muscles help. So these muscles are supported by the hyoid. Vertebral column. Vertebral column consists of vertebrae and sacrum. There are three groups of vertebrae. Cervical vertebrae. In the neck part, how many? 7. So there are 7 cervical here. Then 12 thoracic. So in thoracic part, you have 12 here. And then bottom 5 are lumbar. So 7 cervical, 12 thoracic and 5 lumbar. And then below the lumbar vertebrae, you have a large triangular bone. You see here, you already know that. This is the sacrum, triangular shaped large bone. Actually, developmentally, if you see in infants, sacrum is not a single bone. 5 pieces of sacral vertebrae, they are separated in very early stage of life. Then gradually they fuse together to form the sacrum. So 5. That's why you see the transverse lines or ridges here, where they join together. So in early life, they are separated, 5 sacral vertebrae, they join together to form the large triangular bone. That's the sacrum at around 4 or 5 years.
Is that also the same with the occipital?
Second,
Is that also the same with the occipital bone?
but it's just, many bones are like that. Your hip bone, right?
Yeah.
3 pieces, you remember? 3 pieces, they start ossification, bone formation, then fuse. Yeah, so those lines you see, those are usually where the fusion occurs. Separately they grow and fuse. Then you have coccyx, tail bones. The number of coccyx is not fixed. It could be 3, 4 or 5. So varies the number, and those are tiny tail bones. So those bones form the vertebral column. Now, function of the vertebral column: transmitting body weight from the upper part of the body to the hip bones. So that's why you see here, look at me, the lower end of vertebral column is attached to the hip bones at sacroiliac joint. You probably remember that. Last lab you identified this. Sacrum is attached to the hip bones at sacroiliac joint. So the weight from whole upper part of the body goes through the vertebral column and given to the hip bones, and then from the hip bones the femur takes the weight and take it to the foot, lower part. So transmitting body weight. Number 2, keeping the body straight, erect. That is another important function of the spine or vertebral column. Okay, protecting the spinal cord, very important. You know, inside the vertebral column, the spinal cord is located, present. So protects the spinal cord. intervertebral discs. In between the vertebrae, you have discs of cartilages. You see here, these are the intervertebral discs. And if you see an intervertebral disc, it has two parts, inner part and outer part. So this is the intervertebral disc, inner part and outer part. Outer part consists of a lot of fibers, many fibers, collagen fibers, and that's why the outer part is very tough, because any structure that has more fibers is more tough. So outer tough part where you have many fibers, it is called annulus fibrosus. Annular part, you know, if you see something round, this like a ring, right? Finger ring in your finger. This outer part is called the annular part, and inner part is the nuclear part. Okay, so annulus means around. So this part is called annulus fibrosus because a lot of fibers, and inner part is rather soft, jelly-like structure, and that is called nucleus pulposus. So annulus fibrosus is very tough, lot of fibers in it, annular part, outer part, and inner part is nucleus pulposus, soft, jelly-like structure. We will find it. Okay. So, is it here? Yes. You see, annulus fibrosus, nucleus pulposus. What kind of cartilage is this? This is, remember, I may ask, this is a fibrocartilage. So intervertebral disc is a fibrocartilage. Okay. Another fibrocartilage is here, pubic symphysis. So that's why you see same color, shown by same color. This cartilage is hyaline, that's why it's shown in different color. Okay, so that's the intervertebral disc. Sometimes what can happen, you see, if any pressure from wrong direction, hits the vertebral column, what can happen? The intervertebral disc can slip out, and that is called herniated disc or slipped disc. So dislocation of intervertebral disc, part of it may pop out or come out. Here you see herniated disc or slipped disc. In right side, you see it is the normal position. In left side of the disc, you see here, it has pushed backwards. So that is the herniated part, this part. This is the normal position, should be like this, but this portion slipped backwards. And the problem here is that, you see, just behind the intervertebral disc, you have the spinal nerves. Spinal nerves come out from the spinal cord, 31 pairs, like this. So, behind each vertebrae, you have a pair of spinal nerves. And when the intervertebral disc slipped, out, it pushes the spinal nerves, and that causes severe pain in the area where that spinal nerve innervates. So you see here, this herniated portion has pushed the spinal nerve root, beginning of the spinal nerve, and that happens. You'll hear the patient often complains pain. Herniated disc. What is hernia? Anybody have you heard hernia? You have heard hernia, right?
Yeah.
Hernia is a very broad term. Hernia indicates dislocation, protrusion of any viscous from its normal to abnormal, any part of any organ from its normal to abnormal position. It moves from its normal position where it's supposed to be to abnormal position, that is hernia. If your eyeball pops out, we'll say herniated eye, right? So we we hernia is like this position, this location. Okay. Intestine. If intestine moves from its normal position, goes to another organ, and we'll say herniated part of intestine. Okay. Structure of a vertebrae. Vertebrae has a body and the arch. Body is in the front. If you see here, this is the body. So body is in the front, right? And arch part is in the back. So this part, inter part, is the arch. Now, in the arch, there are 7 processes. How many? 7 processes I mentioned to you. If the bone, this is the bone, if you see something sticking out, right? Process. So 7 processes. What are those? In the back of the vertebrae, this is the spinous process going backward. So all these are spinous processes. So the vertebrae has a spinous process directed backwards. And 2 processes going like this, laterally. Here you see, laterally. These are called transverse processes. So this is the spinous process going backwards, laterally, 2 transverse processes. Then you have 2 processes like this, superior articular processes, and 2 are like this, inferior articular processes. So if you look here, these 2 are superior articular processes and these 2 are inferior articular processes. Now why you have superior and inferior? You see, if this is lower vertebrae, this is upper vertebrae, this is superior articular process of lower, this is inferior articular process of upper, right? Makes sense? Because this is below and this is above. So superior articular process of lower vertebrae and inferior articular process of upper vertebrae, they get attached like this. So 2, right? Like this. That's how they are attached to each other, you see here. Okay. So those are 4. 2 superior, 2 inferior articular processes. Articular means joint. They join to each other. So those are 7 processes in a typical vertebrae. Why is I said typical? Because typical vertebrae are the vertebrae, those are similar. All those vertebrae have these processes, right? But atypical, the term atypical means they are different than normal. They are not typical, not normal. Why I said typical and atypical? Because 2 vertebrae are atypical vertebrae, C1 and C2. Cervical 1, which is called the atlas, and cervical 2, which is called the axis. They have different names. And they don't look like this. All other vertebrae look like this. All other vertebrae have these parts, but except C1 and C2. Make sense? That's why those 2 are atypical vertebrae. We'll talk about that. First, if you want to identify a cervical vertebrae, typical one, except C1 and C2, what you will see, this is the easiest way to identify a cervical vertebrae. If you see the spinous process, look at this picture. Also you can see here, probably you can see from here. You see the end of the spinous process is split. You see here, divided. So that is cervical. Make sense? And in the transverse processes, you have transverse foramen opening. So if you see those two things, that is certainly a typical cervical vertebrae. C3 to C7. That means second, third, fourth, fifth, sixth, seventh. Those five. I mentioned C1, C2 are atypical. They are different, right? Other fives look like this. Other fives are like this. C1 and C2 are different. So C3 to C7 are like this. C1 and C2 are different. You see here, this is a C1. That means atlas. Atlas or C1 doesn't have any body. Body is missing. So this is the only vertebrae which does not have a body. So if you see that, that is C1. Very easy. Make sense? No body. Instead, two arches. So it's like this. You see, two arches. This is one arch, like St. Louis arch, right? This is another arch. So you have posterior arch, which is bigger, and anterior arch, which is smaller. Another thing, just notice, I'll talk about this later. You see, in the anterior arch, inner side of anterior arch, you have a facet for dens. That means this part gets attached to the dens. So we'll see what is dens. If you see C2, you see here, this is C2. This one has a body, but how it is different than other typical vertebrae? Because this one, from the body, you see, if this is the body, a finger-like structure sticks out. This is only in C2. No other vertebrae has this structure from the body, and this is called the dens. Now, this is the dens, you see, the top of the body. Now let's go back to C1. I showed you facet for dens in the anterior arch. What happens? You see, this is the anterior arch of C1. You have the facet here for dens, and this is the dens of C2. Goes like this. Make sense? This is dens, and this is the facet for dens. So get attached like this. Now, this is a very weak point in your body. Why? Your spinal cord. You know that spinal cord passes through this vertebral foramen, and now this is the spinal cord, and this is the dens. This one. So what can happen if I hit this bone from the front? What will happen? This bone will move back, right? If any pressure from here will move back, and this dens is inside. So it will crash the spinal cord. Make sense? Crash the spinal cord, and that can cause death of a person, because in that part of the spinal cord you have the respiratory and cardiac centers. So if crash occurs there, it can cause the person immediately. Okay? So that's a weak point. Got it? So which two vertebrae are atypical? C1 and C2, atlas and axis. Okay. So we'll stop here. Almost done. So you can just go over. Yeah, we can go over those few slides in next class.